And no two patients are ever going to talk to each other and say, hey, Dr. Sanjiv used the same joke twice, You can't be expecting them walking around without a tooth at the front. It is not a cookie cutter. It is not one size fits all treatment. You have to be able to hear when they are talking and when they are giving you something that might seem to you as a beautiful piece of art. I might feel like it's not quite that good.
Yeah, look, that's absolutely right. I mean, look, there is a term what we normally use in dentistry as what we call as a dental IQ. And you are absolutely right in saying that, Sadi, that sometimes patients would come in. They would say, I need a mouth full of implants, or I want all my teeth to be taken out and replaced. And when you look in the mouth, it is not quite that way. Contrary to that, sometimes the patients would walk in and they say, oh, look, I don't have any problems at all. I'm here just for a quick check. And you look in the mouth and it's like an absolute train wreck. It can be a bit like that. So yes, dental IQ is important. It is important for us to mainly be able to assess the patient's dental IQ, primarily for the reason that sets up the expectation of what the end result's gonna be like, because you can be providing the best of the treatment, but if it is not matching the patient's expectation, it will never be successful. I'm not sure if I've actually talked about this before, but I'll just very quickly like to go back to the definition of dentistry, which is essentially it is the art and science. So it has two parts to it. It has got an art and it has got a science to it. And when we talk about art, it is all about perception. Something that might seem to you as a beautiful piece of art, I might feel like it's not quite that good. And similarly, vice versa. So thinking of that, because there is a big art component of it, there is a massive area which is the perception and expectation of the patient. Now, so that brings us to the question of what you were saying, that how do you actually suggest, or how do you actually help them through knowing what is it when they don't even know what they're actually after? And that is where it brings a very important point, which I have practiced over the period of time, and I still try to very diligently try to do that, and that is active listening. When you are actively listening to the patients, they will themselves give you the cues to what they are actually after. Now, they might not be telling you that, look, Sanjiv, I want a dental implant in the mouth. Once again, it's very important that you have to be able to hear when they are talking and when they are giving you the history of their concerns and what they're expecting. You have to be able to understand what is their goal. Are they wanting to smile better? Or are they actually wanting to function better, eat better? Or are they actually trying to avoid a social embarrassment where they're worried that their teeth might fall out? Or do they have to actually go out and do a TV presentation the next day? Just imagine, someone's wanting, yes, I'll just give you a quick example, right? I believe in a conventional way of doing dental implants, which essentially involves that you pull the tooth out, then you wait for 3 to 4 weeks, let the gums heal, then you put the screw in the bone, then you let the screw integrate in the bone for about 2 to 3 to 4 months, depending on the density of the bone, and then you restore it with a crown. But imagine if it is a young girl who's like, in her early 20s, who actually wants a cosmetic improvement, who cannot stay without a tooth, if it's a front tooth, if it's like I have had patients who are actually TV presenters, like you can't be expecting them walking around without a tooth at the front. So it is a little bit like horses for courses. That's very important, right? And that is where you have to, it is not a cookie cutter. It is not one size fits all treatment. You have to listen to the patient. You have to listen to them very careful, understand what their needs are, what their goals are. I always impress in my consultations, I always impress upon how it is important to expand on their concerns. So if someone is saying, like, I would like to smile better, you have to have that skill, and this is what brings it back again to those migrant population or people who, for them, the English is a second language or something like that. It is very relevant for you to be able to pick on some special ways, some special words, sentences that you use. And no two patients are ever going to talk to each other and say, hey, Dr. Sanjiv used the same joke twice, They're never going to talk to each other. So you have to be comfortable, you have to be in your comfort zone to be able to convey that peace and calm to the patient so that the patient feels relaxed when they are sitting in front of you. Now what you are doing is then you are actively listening to the patient. You are using your little communication and verbal skills to expand on their concerns, or more so, expand on their goals. Like if someone's saying, I want to smile better. Again, smiling better can be different for you, Sadi. It can be different for me, right? So you need to know, when you say smile better, you mean you want to show more teeth, you want to show less teeth, you want to show more. You have to give them the cues. Especially, look, it is very easy when someone comes and says, oh, look, I want this, and this done to my teeth. Because they have done the research part of it. They've made the job easy for you. But when someone comes and says, hey, doc, fix my smile, I'm like, oh, wow, okay, all right. So now I just can't take that sitting down there and say, okay, how do I fix the smile? And just start working on it blindly. What I have to do is I have to expand on their goals by asking them, okay, mate, so you say you want to improve your smile. Let's talk about it a little bit more. Is it the color of the teeth? Is it the color that worries you? You think they are a bit too yellow or too white, or how do you want them to be? Okay, is it the shape of the teeth? Is it that you feel that when you smile, your lips go a bit higher, so you show a bit more gum? You know what I'm talking about here? It is about knowing the patient, digging deep into it a little bit without offending them. Obviously, look, please understand that the patient's dental clinic, dental chair is not the most comfortable place for a lot of people, right? So you also need to remember and understand that boundary, that area where you don't want to be making them too uncomfortable by asking them too many questions. And that is where it is extremely important, and we can keep talking about this. This can be a discussion in itself, is the voice modulation. For example, your general pauses in the discussion, which is not making them feel overwhelmed by all your questions, but it is actually making them think, because sometimes even they haven't had a chance to think about it. They just want their smile improved. Their partner said, hey, go and get your teeth fixed. And they just turn up on your chair and they're like, okay, fix my teeth. And you're like, okay, all right. If you don't know what needs to be done, let's sit down, let's brainstorm together, let's come up with some ideas and then do some trial runs and then move to the treatment. Because like as I always say, execution of the treatment is the last part of it. It is all in the preparation and the planning. So quick takeaways from this discussion, I would say very important that you actively listen to the patient. You are expanding and trying to understand what their goals are, and you try to determine and reconfirm it with them. And active listening, once again, a very important part of the active listening that I will like to impress on this here is actually repeating it back to them, rephrasing what they have said. So in ways of saying things like, if I have heard it right, you are not happy with the color of your teeth. So you are actively listening. You are not just sitting there and getting them to just talk about it. You are telling them back, and they are feeling heard. And when they feel heard, that's when you are building up a rapport with the patient. So like as I said, actively listening, expanding on their problems and knowing their goals helps you give them the type of treatment that they're actually after.
Get on your knees. Came from the jungle, up in the trees. I got a few tricks up in the sleeve. One wrong move, I'ma let out the big shoes, check out the crease. Blow like I'm Bigfoot, step on the beat. Make a man's run till he step out the crease. When the whole place scream, gotta get